Welcome to our Vivos presentation. I will be going over a lot of information and encourage you to make a note of any questions you may have. You might be viewing this presentation because you've been told that you have sleep apnea and want to know about alternatives to a CPAP. You may have a child with ADHD or who struggles with bedwetting. You may be here because your spouse snores so badly that you sleep in different rooms. By the end of this presentation, our goal is for you to understand that all of these things that seem very different may have a common root cause. As you watch this presentation, pay attention to what's normal versus what's common and the differences. There is a silent crisis in America. ADD, ADHD, bedwetting, difficulty in school, mouth breathing, snoring, restless sleep, delayed or stunted growth, nightmares, low IQ, chronic allergies, crowded or crooked teeth, dark circles under the eyes, swollen tonsils or adenoids, daytime drowsiness, depression, anxiety, fibromyalgia, obesity, hypertension, aggressive behavior, bruxism, cardiovascular disease, Alzheimer's, opioid addiction, diabetes, dementia, cancer, premature death. Research has shown that 9 out of 10 in America suffer from one or more of these conditions. Do these children look healthy? In the past, I would have thought they did, but now here's what I see. The first child has a double chin and looks like he's overweight. The second child has dark circles under her eyes, dry lips, dimple chin, and lack of symmetry in her face. The third child has a double chin and dimple chin, dry lips, and dark circles. Let's take a look at these children. The first little girl has dark circles under her eyes and looks tired. She has a narrow, small chin, in addition to dry lips. The second little girl has dark circles under her eyes. She can't close her mouth over her teeth. She has very tiny chin, lack of symmetry. She looks tired and sad. The third little girl Could it be that there is a common cause behind the health concerns that we are seeing? What if these symptoms, ADD, ADHD, chronic allergy, mouth breathing, snoring, difficulty in school, dark circles under the eyes, defiance, aggression, crowded teeth, bedwetting, sleep issues, daytime drowsiness, and swollen adenoids were all linked to a compromised airway? Possible root causes are soft diet, weak tongue, processed foods, weak orofacial muscles, low tongue position, and tongue thrust. Where does this come from? Why are we seeing so many children who have really crooked and crowded teeth? Why do 80% of our children need orthodontics? Why don't we see more young children with spaces between their teeth so there will be room for their permanent teeth? Why has this become an endangered species? Is it that all of a sudden children have really big teeth, or is there something else going on? Most of our growth and development that humans experience takes place in the lower third of the skull, the upper and lower jaws. Normal craniofacial growth is wider, forward, and downward. Why are so many children suffering from abnormal growth and development? To get the answers to this question, we're going to look at some anthropology. This is Dr. Robert Corrucini. Dr. Corrucini has done a lot of research on the development of the human skull. Today, we're going to look at his fossil studies and his population studies. When Dr. Corrucini looked at human skulls from 400 years ago, he found that those skulls had bigger upper and lower jaws and that there was room for 32 teeth in those jaws. There is very little incidence of crowded or crooked teeth, and there were no orthodontics around to make that happen. In present time, very few people have their wisdom teeth, and we don't even have room for the 28 teeth without them being crowded and crooked. Dr. Corrucini also studied isolated rural populations, groups of people who were not exposed to things like processed foods and formula. What he found was that these populations breastfed their children for many years, 2 to 3 years, and that they ate a diet that was comprised of hard, tough foods, dried meats, and hard root vegetables. In these populations, they have very little incidence of crowded and crooked teeth, and they had perfectly formed upper and lower jaws. Here are his conclusions. Dietary consistency and toughness promote proper bone growth. When non-resistant processed foods became ubiquitous after industrialization, malocclusion or crooked teeth show a rapid rise. Soft diet or processed foods increase underdevelopment of upper and lower jaws and malocclusion or crooked teeth. Dr. Corrucini observed what took place as Western culture was introduced into these isolated populations. In the first generation after processed foods and soft diets were introduced, 50% of the population began to experience an increase in malocclusion, crowded, crooked teeth. After another generation, this increased to 70%, and after the third generation, this jumped to 85%. It takes 27,000 years for a genetic mutation to express itself in 51% of the human population. So how does this happen in just one generation? This tells us that malocclusion is not inherited. It's acquired. This means that crooked, crowded teeth is not caused by genetics. It's caused by something else. It's caused by a cultural change. We are no longer breastfeeding our babies for 2 to 3 years and no longer eat a hard diet. Instead, we nurse our babies for 6 weeks or 6 months if we can, and then give them bottles and soft food like baby food, macaroni and cheese, and chicken nuggets. This is what we feed our children. This is what it should be. So here is what we know. Most malocclusion is acquired, not inherited. Malocclusion is unique to Western culture, and that the presence of malocclusion is a key indicator of an underdeveloped airway. This is Dr. James Sim Wallace. Dr. Wallace found that an early soft diet prevents the development of muscle fibers of the tongue, resulting in a weaker tongue which cannot drive the primary dentition out into the spaced relationship with fully developed arches, which will lead to more crowding of the permanent teeth. So we know that having a strong, well-developed tongue is important to making sure that our arches develop correctly. When your tongue is not strong and fully functioning, you will end up with a V-shaped Gothic arch and crowded, crooked teeth. When your tongue is strong and functions correctly, you'll have a beautiful U-shaped arch that has room for all of your teeth without being crowded and crooked. So here is an image of the maxilla, the upper jaw. Note that the upper jaw does more than just hold the upper teeth. It also makes up the sinus cavity and the lower orbits of the eyes. Dr. Guilleminault states that the dental arch expansion improves sleep-disordered breathing in patients with upper and lower jaw constriction and can be a valid treatment. This demonstrates what our upper jaws look like today compared to what they looked like in earlier times. This image shows us that the upper and lower jaw area is a major part of our airway development. You can see that if the upper jaw isn't fully developed, it will affect the nasal airway. In addition, an underdeveloped jaw keeps the lower jaw from fully developing because the upper teeth trap the lower teeth and the jaw can't expand forward to the correct position. When the lower jaw doesn't fully develop, it impacts the lower airway. What does your airway look like? What does your child's airway look like? Which airway would you rather have? Here are some images of airways. The red indicates a constricted airway. This video really says it all.
Just a few hundred years ago, the human face was different. It was forward grown. Her wide profile and large dental arches ensured straight teeth and room for her tongue. Most importantly, she had plenty of space behind her upper jaw so she could breathe through her nose with ease. The modern face has changed. From childhood, her dental arches are less developed, crowding her teeth and giving her less space for her tongue, which impacts her airway. Many believe this stems from a number of causes, such as allergies that affect breathing. Another is the poor nutrition and softness of modern diets, causing toddlers to have underdeveloped chewing muscles and smaller dental arches. Because her upper jaw is too far back, she will struggle to breathe normally through her nose. To get more oxygen, she will compensate by opening her mouth to breathe, bringing her lower jaw down and back, creating a downswing of the face. This is how her undergrown upper jaw creates the appearance of buck teeth. She's actually compensating in order to breathe. If not corrected, the problem carries into adulthood. Extractions were documented in the 1600s as a way to treat crowding. Although they are a quick fix, they don't treat the problem of underdeveloped arches and have been implicated in harming the facial profile, making them the subject of much debate even today. Adulthood. In order to breathe, she will slouch her head forward to prop open her airway, creating a lifetime of neck and back pain. This is the infamous forward head posture. Having a healthy airway is crucial to the survival of life, and especially so during sleep. When muscles around the throat relax during sleep, a healthy airway stays open because the tongue is sitting forward and has enough space to be suctioned up against the fully grown palate. With underdeveloped jaws and dental arches, the palate is too small for the fully grown tongue, which is sitting back to begin with. When she sleeps, her tongue does not suction, rather it falls back and cuts off her airway. This is obstructive sleep apnea. Like crooked teeth, it's a modern condition. However, it can reduce life expectancy. Not surprisingly, obstructive sleep apnea is marked by the same traits that describe the headgear effect. Both jaws are grown down and back, creating a clockwise rotation in the lower third of the face. The myth of the overgrown upper jaw that needs to be held back has long since been replaced with science. Science has shown that young children can be buck-toothed naturally, and that the lower jaw catches up over time with a fully developed upper jaw. Essential to this is nutrition, the use of chewing muscles early on in life, and good breathing habits. This means breathing through the nose with the mouth closed and the tongue resting up against the palate. Also, the practice of maxillary expansion has been shown for over a century to correct crooked teeth and improve nasal breathing space. And since 1918, orofacial exercises have been shown to correct mouth breathing habits. Children.
Now he's holding it.
This is Ellie, and this is a
That was
great
holding it.
demonstration of what a
Still
child looks
holding
like
it.
when they're
He's trying to take
struggling
in
to
air.
get air while they're sleeping.
There he goes. Okay, now watch. He's holding it. He's holding it. He's holding it. He's holding it. He's still holding his breath, and now he's going to gulp again. There he goes. That was it again. And again. He's holding. He's holding. He's trying. There he goes. So this has been 3 minutes and 15 seconds, and you can see how many episodes he's had of not getting calm breaths in. Now, watch what happens when I take his jaw and I just bring it forward. If I can. Let's see if I can. And I open his airway. Just bringing his airway forward. Now listen to the quiet breathing. There we go. Now he's breathing through his nose. And I brought his airway. I'm opening his airway. Just pulling his jaw forward ever so slightly. And now he's breathing through his nose quietly. His mouth is a little bit open, but he's breathing through his nose. Just by hear how quietly he's breathing, you don't hear him anymore. And all I did is gently bring his jaw forward.
So what does this tell us? The development of the upper and lower jaws has a huge impact on how we breathe. So what happens when the upper jaw is underdeveloped and a person is not able to breathe through his or her nose, so breathes through their mouth? When you breathe through your nose, the air is warmed, filtered, and humidified. When you breathe through your mouth, this doesn't happen. So unfiltered, dry air is hitting your tonsils. And what happens? You end up with inflamed and swollen tonsils, which further impact your ability to breathe. In addition, nitric oxide is produced in your sinuses. Nitric oxide is a vasodilator, which helps our bodies absorb oxygen. When you breathe through your mouth, the oxygen is not mixed with nitric oxide, so your body doesn't absorb the oxygen as efficiently. Nasal breathing is very important for our bodies and our health. Dr. Eichel Harvold did research on young adolescent monkeys. He blocked their noses and did airway studies to see the impact of mouth breathing. He found that nasal obstruction leads to mouth breathing and low tongue posture, which leads to malocclusion. The pictures on the left are pictures of monkeys before their noses were blocked. The pictures on the right are after the monkeys were forced to become mouth breathers. Look at the differences in how the monkeys look after a short time. Here is what we know. When you have a compromised nasal airway and you breathe through your mouth, it leads to low tongue posture. It also causes tonsils and adenoids to swell. Dr. Sten Linder Aronson did studies on children. He looked at children who were mouth breathers versus children who were nasal breathers, and he found that nasal obstruction leads to mouth breathing, which leads to low tongue posture and high rates of malocclusion. So it's really important that we get people breathing through their noses. So how does all this connect to ADD and ADHD? When you have a child who is mouth breathing and has a small airway, it impacts how that child is able to sleep, and they may experience restless sleep and nighttime arousals. When a child doesn't get a good night's sleep, it impacts their life. Dr. Maraglia is going to share how airway and sleep may be linked to ADD.
Now take a child, alter their quality of breathing and sleeping. And the real big issue now is how will they be during the day? So now you take a child who's 5, 6, 7, 8, it doesn't matter. Their issue has begun years ago. So it's not like you had 1 or 2 bad nights of sleep. You've had a poor quality of sleeping and breathing for years. And the parents have been struggling with so many different issues, and not the least of which is the ADD, ADHD discussion. Because the child who doesn't get a proper night's sleep with a good quality of breathing throughout the entire night is going to wake up and be unrested. And when you get a child who's had a poor quality night's sleep, poor breathing all night long, and you make that happen for years, you know what you've got? A 6, 7, or 8-year-old that's going to go to school and have trouble learning, have trouble sitting still, have trouble behaving, have trouble cooperating, basically have trouble fitting in to what is supposed to be a quiet and peaceful and learning environment. And it's not long after that where the phone call comes to the parent. And when the phone call comes to the parent from the school, what happens is, we have little Jimmy here and he's a little bit disruptive and we really want you to have him evaluated for ADD and ADHD. They're going to be diagnosed with ADD and ADHD. And our solutions are pharmaceutical. If we are given a pharmaceutical, it's usually in the form of some sort of a stimulant. And what that does to the child is it kind of pushes them over the edge and it brings them back to calm. So you basically take an excited or hyperactive child, you stimulate them more, and you bring them back to so-called calm. But it doesn't make a better learning child. You're not going to have a child who's able to learn as well. So now you might have the child sitting still in class because they might be a little more numb or relaxed or calm, but it doesn't necessarily make them a better learner. If we have the so-called ADD, ADHD diagnosis, we're talking about hyperactivity. We're talking about all of the things about behavior and development that land in this category. And the interesting thing about research is, and there is current, ongoing, and past research that shows, children who are sleep deprived produce the same exact symptoms as kids who are diagnosed with ADD and ADHD. In fact, there's a nice study that showed children who were diagnosed with ADD and ADHD were mixed with children who were sleep deprived. And in that group of kids, when they tried to analyze them and look at their symptoms and diagnose them, they couldn't tell them apart. And if you have a group of kids and you can't tell apart who's an ADD child and who's a sleep deprived child, it's no surprise that maybe the ADD and ADHD has a cause. And maybe that cause has to do with the quality of the breathing and the sleeping overnight. And there's a lot of research out there, and one of the pioneers here is Dr. Stephen Sheldon out of Lurie Children's Hospital in Chicago. And he does a wonderful job of researching, and over the decades, he's come to a conclusion, and I've seen him speak, and it's not soon after he jumps on stage and he makes a statement that ADHD and ADD do not exist. They are an outcome of a sleep disorder breathing. They're an outcome of a poor quality of sleep. It's all about the quality of sleep. Another researcher who's produced beautiful research on the same topic is Dr. Karen Bonnick out of Einstein at Yeshiva University. Dr. Karen Bonnick has the largest study to date. 11,000 children were watched over 7 years. And they were divided into two groups, sleep disorder breathing children and children who do not have sleep disorder breathing issues. The children in the sleep disorder breathing group, over their 7 years, her study showed that they were 50% more likely to be diagnosed with an ADD or ADHD diagnosis and treated with medication. 50% is a coin toss for our child to be diagnosed and treated with a medication. Also in her group, they were doing testing. They were doing IQ or intelligence testing along those 7 years. And the children with the sleep disorder breathing, their intelligence testing, their IQ scores were dropping over those 7 years. And that's really not the way it works when you're growing and forming. The formative growing years for a child, when they're sleeping and breathing well, your IQ raises to a certain point and then you kind of plateau. We don't see IQs diminishing amongst children.
This is the research that Dr. Miraglia references from Dr. Karen Bonnick. She studied 11,000 children over 6 years, and she found that there was a strong and persistent association between sleep-disordered breathing and diminished IQ. She also found that the sleep-disordered breathing increases the risk of being diagnosed with ADD and ADHD by 50%. So now you may be asking, how is all this connected to bedwetting? Dr. Miraglia is going to explain the connection between bedwetting, airway, and sleep.
Another thing that might happen is bedwetting. Bedwetting, it's a little more common than people are aware because it's also a best-kept secret. Not many people are running around and advertising that their child is bedwetting at the age of 5, 6, 7, 10, 14 years old. But bedwetting does have a relationship to how we're breathing and our quality of sleep. And some of the causes for bedwetting relate to the way oxygen is exchanged in our body. And the way I'll describe it is this. If we're breathing through our mouth, that air coming into the lung isn't really filtered, warmed, or humidified appropriately, and the body can't exchange it appropriately. So a little less oxygen goes to the brain. Now, the brain is a very sensitive organ. When the brain recognizes little changes in oxygen, it goes to work immediately. Because once the brain starts to recognize a little less oxygen, it doesn't know if we're being choked to death, a very serious condition, or if there's an imbalance in how we're breathing at night, but it does start to trigger a little bit of the fight or flight response. And a little bit of the fight or flight response means the brain's going to look at the body and say, all right, if we've got a little bit of an oxygen issue going on, I'm going to pull oxygen from something that it picks to be unnecessary right now and maybe deliver it somewhere that might be more important, planning on a rare occurrence as if the oxygen was going to stop. So if the brain's recognizing a little less oxygen, all of a sudden it's pulled from the urinary tract. If the body pulls a little oxygenation from the urinary tract, it might void. So we might wet the bed.
This video was made by Connor Deacon's mom. He wasn't treated with Vivo's appliances, but it's a very powerful video on how airway and sleep impact a child. So how can dentists help? This is Hunter. Hunter struggled with bedwetting. When you look at his teeth, he has a deep bite and no room for his permanent teeth to come in. Now we know that this is a sign of underdeveloped upper and lower jaws. This is what he looked like after 10 months in treatment, and he stopped wetting the bed just after 1 week in treatment. Why? Because he was able to breathe better and sleep better. This is Paige. Paige also had a deep bite and a lot of crowding. This is what Paige looked like after treatment. Look at that beautiful development of her upper and lower jaws. Remember Michael? This is Michael at age 9, and then at age 14 after treatment. Look at the difference in Michael's teeth. But better than that, look at the changes in Michael's airway. This is Dr. Tara Griffin from Florida. This video shares Dr. Griffin's experience with Vivos.
I'm Dr. Tara Griffin. We are here today in my clinic in Panama City Beach. I've been practicing dentistry for over 11 years. Before I discovered the Vivos appliance, I was suffering every day with chronic head and neck pain, TMJ pain. I was practicing dentistry and been practicing for 5 years, but I was already looking for an out. I knew that with this much pain, I could not continue to practice dentistry. I had chronic sinus and allergy problems, bronchitis. I was not sleeping throughout the night very well. I was waking up during the night. I had severe daytime fatigue where I would need to go home and actually take a nap in the afternoon, just at lunch, you know. And so I was looking for a solution to the problem, but I didn't know what the root cause was until I learned about the Vivos appliance. As soon as I started treatment with the Vivos appliance, within the first 2 nights, I was sleeping soundly throughout the night. My energy was better during the day. The pain that I was undergoing took a bit longer to get resolved, but within the first 3 to 4 weeks, my pain level was reduced by 2/3 or more. Within a month's period of time, I was breathing through my nose better. I wasn't having the same sinus symptoms that I was having before. And within 3 months of treatment, my asthma had improved so much, I had no more problems with the inhalers and the frequency I was having to use with all of my asthma inhalers. My overall health started to improve very quickly. I was my own first patient. However, as I continued to treat the next patient and the next patient going forward, I was curious to see if they were going to have the same outcome that I had, and they did. 9 out of 10 had the very similar outcome that I had. So they were sleeping better in just a few nights, actually getting their energy back. They were less irritable. The pain that they had was going away very quickly. The teeth were beginning to straighten and align over time. So even though with this type of problem, it can take some time to get the long-term results, the immediate symptoms start to improve very quickly. Comparing my before and after picture with the Vivos appliance, my smile was not symmetrical. My teeth were crowded. The gumminess of my smile was a major problem that I didn't like. I had unevenness in my eyes, also in my nose. My face was more round and less balanced, and that all helped to correct itself as well as I went through the treatment. When the Vivos appliance is worn in the early evening and while you sleep at night, it allows the jaw to relax. It allows the airway to open up. It allows you to breathe through your nose and to get the oxygen that you need to the rest of your body for your body to begin to heal. By breathing through our nose, we are actually getting much more oxygen to our brain as well as our lungs, and we're producing nitric oxide, which is a vasodilator to allow the blood flow and everything to circulate better. And so a big component with this is it forces you to actually breathe through your nose to get the oxygen where it needs to go into the body. So that's a very important part of this. If you're interested in learning more about the Vivos appliance, if this would be good for you, then I recommend you coming into a Vivos center to be evaluated to determine if this is something that could help you.
Here are the changes to Dr. Griffin's Airway. What changes do you see? When smiling, I notice that I'm now physically unable to smile as big as I used to. My gums are now barely showing. My face feels different when I smile now. I don't know how to explain it, but it's a great thing. When I speak and eat, my jaw no longer pops. I can speak more clearly and feel a noticeable difference in the amount of room my tongue has. I can breathe very well through my nose now. I'm very happy with the results. Vivos has developed a proprietary, multidisciplinary treatment protocol. Expand the dental arches. Promote healthy nasal breathing. Discourage and eliminate mouth breathing. Nasal breathing prepares air by filtering, warming, and moisturizing for optimal assimilation in the lungs. Train the tongue. Strengthen and condition. Reposition the tongue up and forward. Promote proper swallowing and speech. Eliminate bad habits. Thumb sucking, tongue thrust, reverse swallow. Vivos is a treatment system made up of screening, medical imaging, and diagnostics. Please don't hesitate to contact us with any questions that you may have.